Good afternoon now, everyone. It is my true pleasure to welcome all of you to the final pitch competition for the inaugural Public Health Innovation Accelerator. My name is Terry Huang, and I'm the founder of Firefly Innovations. Firefly Innovations was founded late 2019, so a little less than a year ago, to really spur, accelerate, and scale up public health innovation. Recognizing there's so much more that needs to be done in the face of daunting public health challenges around the world, particularly now, right? And so in light of the coronavirus pandemic, we pivoted the concept of a public health innovation accelerator towards issues that are particularly relevant to addressing the pandemic. And this year, we quickly pulled together a competition, and we had approximately 50 entries within just 1 month. And out of 50 entries, we selected 8 teams to be part of the summer program. And over 10 weeks, the 8 teams have worked diligently with the mentors, speakers, and other expert advisors. Collectively, there were almost 70 individuals who volunteered their time to work with our venture teams over the 10-week period. And we're just so grateful that so many people jumped in to support us and support the ventures. So thank you so much to all the judges and mentors and speakers who are part of this journey with us. Before we get into the pitches, I want to particularly thank the teams who have worked so hard, but also the operational staff, particularly Alessandro Ciari, who has really spearheaded the logistics for the entire summer period. Emily Ferris, Ansley Hobbs, also from the CUNY School of Public Health Firefly Innovations, and Remy Artiaga and Faith Jakozwiak from CUNY Startups, who have done so much to support this effort and really helping us bridge the gap between business, entrepreneurship, and public health. And so much of what Firefly is about is to create this essentially new area in public health and crossing that chasm to learn from business mechanisms and instruments to spur public health innovation. So we're really grateful for Remy and Faith's support and help. Also equally important is the support of CUNY leadership. Because we're creating a new field, it is very apropos that today that we have the leadership of both the CUNY School of Public Health and the CUNY Zicklin School of Business to be with us. So thank you so much to Dean Ayman Almohandes from the School of Public Health and Dean Fenwick Huss from the Zicklin School of Business to be here with us and to say a few words. So I'm gonna pass the mic on to Dr. Almohandes to say a few words first. Ayman? Ayman, you're on mute.
Indeed. It's the number of times we will have recorded that phrase, you are on mute. I'm beginning to think it has many, many, many deep levels, this brief, small sentence. I hope I have been unmuted in all ways. Welcome and good afternoon. As the Dean of the top-ranked public school of public health in the tri-state area, I'm very, very proud and very grateful to be involved in this Innovation Accelerator demo day, if nothing else, to welcome you and to acknowledge to you and with you the importance of this activity to the school and to new perspectives of public health in general. COVID-19 and New York City as the seat and the eye of the storm in the COVID-19 pandemic outbreak in the United States has a very, very important role to play in terms of thinking about what this pandemic means in the public health perspective, but also in the more global perspective of the responsiveness to challenges that meet us as a community, as academics, as innovators, and as entrepreneurs. One thing that we have learned is that our planet itself, the planet we live in and the world we live in, is generative in nature, and that societies, although some of them may remain dormant, can be rapidly adaptive in ways that are unexpected and hard to predict. In the SDG goals, we understand that for us to be able to respond to challenges as presented to us as this pandemic has presented, need to be intersectoral and collaborative, and need to be innovative towards many of the goals of the sustainability development goals. As described, they need to be people-centered, they need to have universal applications, they need to be integrated, they need to take into consideration partnership, and in that vein, they need to be empowering, especially to communities with the lowest reserves, be they economic, psychosocial, political, or otherwise. That is the challenge for us in the realm of public health in general, and nothing more than the COVID-19 to highlight the importance of public health professionals reaching out to other domains, humbly, intelligently, and collaboratively towards finding new solutions. One of the things that we have already learned is how limiting it is if we seek solutions but cannot envisage the importance of inter and cross-disciplinarity. And I think we are witnessing every day the limitations of approaches that are stagnant and not innovative. So it is particularly poignant at this point in history to celebrate your efforts, both as speakers today, as mentors, as advisors, and to particularly express my gratitude to all of you for having volunteered your time, your effort, your intelligence, and contributed so generously to this new innovative effort within the school, the university, and New York City. Again, expressing my gratitude and my humble appreciation and admiration of the group that's assembled today, wishing you a tremendously successful day, and hopefully something will come out of this that can become not just a model for our city or our community, but nationally and globally as well. I'm very ambitious about this project, and knowing who is involved makes me even more optimistic and more ambitious. So again, please accept my gratitude and my welcome.
Thank you so much, Dr. Almohandes. Next, we have Dr. Benwick Hus, who's the William Quicker Dean of the Zicklin School of Business at Baruch College, City University of New York. Dr. Hus has been a leading champion for entrepreneurship at CUNY and beyond. And we're just, so thrilled that you're with us today, Dr. Hus. Please, the mic is yours.
Good afternoon. It's my pleasure to join you. We're delighted to be a part of this CUNY Public Health Innovation Accelerator Showcase. This is the CUNY Startups 10th demo event in collaboration with our Field Center for Entrepreneurship. The Field Center for Entrepreneurship is really one of the leaders within our school, both in terms of curricula, research, and also especially outreach to the community. And it is through collaborations like this with the School of Public Health that I'm sure the impact of the city, of the center, will continue to grow. A couple of special thanks to MFUG Bank for their support. And also I'd like to express my support to the Fields family for their continuing support of the center. I think Lisa, Robin, and Anthony from the Field family may be joining us today. And if you have, we welcome you. We're delighted to have you as a part of this. I think you'll find this a very interesting collaboration. The Zicklin School celebrated its centennial last year. So for 100 years, entrepreneurship and innovation have been our DNA. And I think it'll be very interesting today to see how entrepreneurship and innovation will have a significant impact on public health. I've remarked in the last few weeks that some of our innovation has been under a bit of pressure. It's innovation with no choice other than to innovate. And I think that's what we're seeing across a number of sectors. So I look forward to hearing the various ideas and proposals. I'm sure all of these who are part of the audience will be impressed. And I would also like to thank the mentors and others who have supported the development of these efforts. Thank you.
Thank you so much, Dr. Haas. And I would remiss to also not thank the CDC through the NYU CUNY Prevention Research Center in supporting and sponsoring today's event. So thank you so much to the PRC and the CDC alongside MUFG. Okay, so I'm now going to turn the mic over to Remy, who's going to briefly describe the rules for today and also introduce the judges and the teams.
Welcome, everyone. I'm excited to have you all here. I'm really excited to be part of the Public Health Innovation Accelerator. I'm Remy Artiaga. I'm the Executive Director of CUNY Startups. I want to introduce our judges, Bruce Y. Lee, Maria Belisari, Nicholas Hoffman, Rebecca Woodcock, all outstanding judges, either in the public health and or the venture capital community. We also have joining them is Stan Kagnowski, Mona Mawafi, and Mark Fillerman. And also joining them is Noel Goddard and Pranavi Chikamurti. I'm really pleased to have those judges on board. They're taking time from their day, and they also bring such great expertise, and they'll be doing the 5-minute question and answer. Each team does the 5-minute presentation, followed by a 5-minute question and answer, and there's 8 teams today. I remiss if I didn't thank Faith Jaskowiak, Alessandro Chiari, Emily Ferris, who have really put in the blood, sweat, and tears to make this a reality. Without them, we wouldn't have this accelerator moving on. And I know how much work they all put in, and we're so appreciative of that. I want to also thank the MUFG Bank, along with the Lawrence M. Field Center for Entrepreneurship. That's where CUNY Startups is located, which is also part of the Zicklin School of Business. And a special thanks to the CUNY Graduate School of Public Health and Health Policy. The way I look at this accelerator, we brought the entrepreneurship, they brought the intellectual property, and together I think we have a little bit of a magic here. I also want to thank the application that's being used for voting, for fan favorites, for the judges today. It's called the pre-app. It's the nice cute little logo below. And you can go to pre.vc, and Sarbajit, the founder, has been a tremendous supporter and just really outstanding in helping us go through all this. And last and not least, but first, is our mentors, really the foundation upon which this whole program is. All of these mentors are outstanding. They either come from the fields of public health, entrepreneurship, or venture capital and angel investing. They're tremendous. They volunteer their time, and each week they would meet with the startup teams, and I think they did an outstanding job, and I'm humbled by what they've done. And I want you to make sure not to forget us and on social media and put hashtag PHIA, whether it be Twitter, Facebook, TikTok, Instagram, and I'd love for you to do that. So now I want to go on to the show, and we'll be starting with the competition with the 8 teams, with the first team being Bon Buten.
Hello, can everyone hear me?
Yes.
Yes.
Okay. Hi, everyone. Thank you so much for being here today. It's my pleasure to start the competition. Imagine that we are all going back to work. We are part of the new normal. We are wearing masks every day, whether we are inside talking to the coworker or we are outside taking a lunch break. What option do we have? Sorry. Either we have the disposable mask or the N95. The disposable mask, on one hand, is very easy to breathe. It offers protection for those around you, but it doesn't really offer you any protection. On the other hand, the N95 offers the ultimate protection for you, but it's really difficult to breathe. We see that there's something missing in the middle. My name is Ling. I am the founder and CEO of Bon Buten, and we are introducing the first reusable, comfortable, and breathable graphene mask. Graphene mask is powered by the graphene filter. So what is a graphene filter exactly? Graphene is a nanomaterial, and it has amazing property, especially at the nano level. It is hydrophobic, so the micro droplet that contain the virus cannot go through it. That's number one. And number two, it has been scientifically proven that there are some antiviral property for the graphene as well. How do we know this? Our team has been working with graphene for a long time. And actually, we have 5 issued patents on the core technology of the graphene property. We launched our pre-sale campaign for the mask in North America a few weeks ago, and we actually received amazing traction. We raised $3,000 in the first 24 hours. To date, we are shipping our products all over the world. And in order for us to do that, we actually secure a production facility in Asia. In the past few weeks, we have shipped out almost 1,000 masks, and we're receiving overwhelming response from our customer, from Charles in Boston to James with like the COVID-19 protection and Mary. So you can see that we have the support from not only young professional, but also the senior citizen. Currently, we only offer our product direct to our customer on our website. We are thinking about, and we are working on providing our mask as a solution for the business, from manufacturing to education and healthcare as well. We are so lucky to work with amazing partner. National Science Foundation, actually the research partner who support our core technology. We are working with W.L. Gore, the maker of Cortex, on the filter material, and we are negotiating and working with Autonomous and Brink as a potential distribution deal. Disposable mask not only poses a huge problem on our planet, it is also a huge business opportunity. It is a $6 billion business opportunity. So let's take a look at the unit economics. Currently, it takes $5 to make a mask and $2 per filter. And we are selling the mask and the filter for $25. We actually found out that people would like to get a combo of 5 filters with the same mask, which can help them up to 3 months of uses. So with $15 here, $10 on the filter, $5 on the mask, we can sell this for up to $50. If we can really execute this vision, we will be $150 million by the end of 2024. Just take a look at the feature benefit for our mask. So ball mouton mask is the only one that offer breathability, reusability, comfortable, and then we are the only one have the replaceable filter on the market right now. We are so thankful for the CUNY Accelerator. When we first come on, we just have an idea. Now we are in production and we are shipping our products. By the end of this year, 2020, we are working to launch the B2B campaign to validate the product and market fit. Hopefully by the end of 2021, we will be talking about growth plan and raising the Series A. Our multidisciplinary international team houses a combined 50 years of experience from scientific discovery, product engineering, supply chain, and design. We believe that we are the right team to bring this product to the market and make a big difference. The future is now. The new normal is here. Join our mission and wear a mask. Thank you so much. And I'm ready for the questions.
Yeah, thank you so much, Van. Thank you so much, Lynn. Really appreciate it. And so, Bruce, you're up for a question.
Okay, yeah, thank you for the presentation, and thank you for illustrating the need for masks. This has become a fairly crowded field. There's a number of people developing masks or repurposing masks or changing masks. Could you expand upon the quote-unquote competition and the alternatives and what distinguishes your masks from the other possibilities that are being developed right now?
Sure. I would like to answer the question. Thanks, Bruce. Mask is becoming the new normal, I guess. So right now, just like similar to clothing, mask will be, I would believe that really the market that not only having one competition, but then we are, it is a market big enough for a lot of different people. So I think that for our perspective, if we want to be, we want to bring not only the graphene technology that go into the mask, we also want to provide like a really high-end like efficacy and also like, yeah, I would say that what I'm trying to say is like, we are the first like reusable and comfortable mask. So yeah.
Could you elaborate on like the competition? Like how do you segment out the competition for this, you know, versus this mask? Because there's different alternatives that are being developed, and could you just maybe expand upon how, you know, where do you fit into that whole landscape of competition?
Mm-hmm. So early on, we know that we are not the consumer brand. We are not going to target the medical, so we stay away from those two areas. Still, we launch our B2C campaign because we have a really good like customer base already. We have almost 3,000 people in our email list. And then when we're sending out the pre-sale campaign, we receive amazing support. Going ahead, we want to be in the B2B, direct to business. And then we consider wearing masks is like a reopening strategy for different business that require like in-person transaction. So we're actually talking with several real estate developer at this moment. We are also talking with bank at the moment. And then as I said it before, we are talking with several university and manufacturing, so where we can really offer the solution for them. We are not targeting the medical.
Thank you so much for those questions, Bruce, and thank you for the answer, Lynn. I'm just going to move to if not, we can go into Nick Hoffman.
Sure. Yeah, thank you. Just wanted to say a quick thank you for having me. I'm delighted to be a part of the event. Quick question on the product. You know, you've described it as sort of it's living in the space between medical and casual. How did you think about, or just let me know a little bit more about the regulatory requirements that you may or may not have? You know, did that factor into kind of, you know, where you decided to play? And then, you know, do you foresee or have you considered product liability risks and maybe how that drove your decision, sort of where to play in that continuum as well?
Sure. Thanks for that question. Early on throughout the program, obviously, we were introduced to a lot of consultants. We look into certification, we look into FDA approval process, we look into the EUA, which is the emergency, which is like basically for the mask as a class 1 or class 2 device. So right now we are not going to medical. So we are not, we don't need to compare ourselves with the N95 for the medical market. Currently, we are offering our product as a protection for workers, protection for the normal user, but then it could be in the normal day-to-day use or in the business professional setting. We are going ahead with some certification like bacteria, like a BFE, bacteria filtration efficacy. We are going to test, and we are actually receiving approval on the flammability and then other necessary requirement and certification for the consumer mask. Going forward, you are asking on the product liability. That is a good question. And then because we are so early in the process, we will need to look into product liability. We will need to look into different regulation. For example, in different states and different country, we will need to look at that. Thank you for bringing it up.
Thank you so much, Lynn. Really appreciate it. And we're going to be moving to our next venture now. And thank you, judges, for those questions. We are going to SIPPA, which is led by Dr. Bonsai. And we'll also have Mike Russell speaking for the team as well. And now, Bon, you can go ahead and share your screen.
Can you see my screen right now?
Yes, I can.
Great. Mike, is your audio on?
I can hear you. Yes, Bon.
Great. Thank you so much. And it has been an honor in this program. So let me start my slide. Good afternoon, everybody. We are the SIPPA team. We help patients to succeed at self-health management for better outcome and lower cost. I'm the founder of SIPPA Solutions. I'm also the 3rd generation in my family with diabetes. I'm a data scientist. I'm a PhD in the field, but I'm still found that a challenge to manage my diabetes on a daily basis. I'm very concerned about the genetic links to diabetes for my children. At the national stage, 743 people die from diabetes and related complications. Over 30% of Americans are diabetic or pre-diabetic. Many self-health management programs were offered by payers and care providers, but most fail to engage 75% of the patients. Solving these problems can save $3,200 per patient per year. Our solution is an engagement platform that offers a mobile app that helps patients to easily gather their vital sign data from self-monitoring and securely share that with their doctors with privacy protection. Now with the insights from the self-monitoring data, doctors can develop personalized intervention that works for their patients. Our product for delivering this solution is built upon 6 patents that enables a smart chatbot embedded in a mobile app to help patients gather their data, a biometric encryption scheme for secure data sharing, and behavior predictive analytics at the back end to help doctors get insights. Currently, our product is in a pilot stage with 200 some patients referred to our study. Those in our intervention phase on average has an 8% improvement in engagement with diabetic self-care and 17% increase in compliance with the doctor's recommendation. We recognize we're not the only one in the field. The two most important attributes that we enable for the success of engagement are personalization and secure data sharing. SIPPA is the only one that delivers these two features using patented technologies that are critical to the success of the proven engagement in self-management.
Thank you, Bon, and good afternoon. This is Mike Wassel. Today, there are 34 million people in the United States with diabetes, costing the healthcare system in excess of $300 billion per year. The underserved population represents 17% or $50 billion in cost to the system. And we are initially focusing on the underserved customer segment in the New York City and Philadelphia metropolitan area. We know from the results of our ongoing pilot study that we are making a positive impact on this population cohort, which primarily consists of blue-collar workers, the majority of which are minorities, making less than $50,000 per year. As I mentioned, our initial target customers are those organizations that serve the underserved community. We will then address the opportunities in small business with less than 200 employees, followed by accountable care organizations and small to mid-sized hospitals. Our revenue stream will come from subscription-based services, licensing fees, and teleconsultation. Our financials show that after a 5-year ramp up, we have a mix of 52 customers from all three segments with 60,000 individual users of our engagement platform, from which we generate $8.5 million in revenue and $4.1 million in EBITDA. On the capital raise side, to date, SIPPA has received $1.3 million in funding, primarily from the National Science Foundation and CHIME, which is a consortium of C-suite healthcare leaders. The funds were used to build a technology platform that exists today and conduct research validation. We are currently seeking $750,000 in a safe investment round, the proceeds of which will be used for customer acquisition and marketing, to support new pilot outreach, platform development, and working capital. The team, in addition to Bon and myself, is supported by individuals with expertise in diabetes treatment from the New York Presbyterian Hospital, patient behavior from Stanford University, a design and usability expert formerly with IBM, a seasoned intellectual property strategy expert in IP prosecution, and external marketing and branding experts. This is a SIPPA solution. Thank you so much.
Thank you so much. Thank you so much for the presentation. And we're going to go into the judges' questions. And next up we have is Rebecca Woodcock.
Thank you, and nice job on the presentation. One thing that I'd like to get a little bit more clarity on is just the user experience. What is it, both on the patient side and also the physician side? So from a patient perspective, what is it that they have to do, or how are they engaging with the app? Are there certain benefits they get from using the app, and what are those things? And then also on the physician side, what are the insights or benefits that they're getting by using the platform?
Sure. Thank you for the question, Rebecca. So I would try to talk about the user experience on the patient side first, and then I will move over to the provider side. Now, on the user experience side, since we are using technology, so the first thing that we know is this is not going to work for everybody. And that is why we drill down to the patient population persona, who it may work, who may not work. Now, for those that could be engaged For them, it's relatively straightforward that every day they would receive a notification to either improve their awareness, their knowledge in diabetic management, or build their skill set and behavioral discipline on that. Now, why this will work? The secret sauce for that actually is not just simply rely on the app and the patients, but actually is to bring the physician into the loop, right? And when we talk about compliance ratio, essentially we're talking about in consultation with the doctors, what they think could be personalized for that particular individual, and what do we know about the behavior readiness of the individual. So therefore, for this to work, essentially is it needs the partnership cooperation of both parties. We are essentially just providing a technology enablement solution to bridge the two. Now, on the provider side, and the same, not every physician are on board for EMR system. Actually, it came out on the meeting last week we have with one of the organizations. And the question was, well, what are you going to do if the doctor office is not using EMR systems? And that is how we build out the platform with that consideration. The way that it communicates is not just simply relying on the app. If they want to do push notification, we do push notification. If they want to do just text messaging, we do text messaging. But if they already are resourceful with the EMR system, we can actually push over the personal health record in the standard format like CCD or file. So that we can kind of really try to accommodate different scenarios of the patient side and the provider side as well for that.
Thank you for that.
Well, thank you so much for the question and the answer. We're going to move next to Stan Kachnowski.
Thank you, and thank you for a great presentation. Had a quick question here around patents and any kind of intellectual property that you have that you might consider patentable, and where you might be in the patent process and those issues.
Sure. So today, we have 7 patents. One was acquired already by a IP acquisition entity, and the other 6, 3 have been issued. One of the 3 were licensed out from CUNY. The other 2 are from within SIPPA. And the one that we licensed from CUNY is under the term without restriction on the use, as well as who we can license that to. And the other 3 that are currently pending, one of the 3 is on the stage of the PCT in Europe, EPO, Australia, Canada, and I think Hong Kong is coming up in terms of the priority date that we're working on right now.
Good. Well, thank you for that. We can add in one last quick question here for from Mona Moafi.
Sure. Thank you very much. I'd like to ask a question about target market and impact. So to date, have you been focusing exclusively on the US market, and have you considered expanding to other areas of the world where we see a very high rate of diabetes and chronic
Sure.
disease in general? So where you might have a strong target market, and have you thought about then what the implications might be for language and also
Sure.
you know, integration with medical system?
Right. So I would start out with the our experience. Even with the U.S. market, we are dealing with Spanish, which is one of the underserved population with a high prevalence rate on diabetes, as well as Chinese are the 2 that we're looking into right now. And expanding to the international market, one of our competitive advantage actually is the ability to work with the hardware devices as well. So we are right now in the process getting opinion from the legal counselor about the regulatory compliance on the devices when we go beyond US. US is FDA, but beyond that, we need to find partnership to source that device, aspect of that. And in terms of expanding beyond the US, that has always been what we were trying to do. As a matter of fact, when we came to this Accelerator program, when we were being asked what is the one thing you want from this program, we say we want community engagement. And that's our answer.
Yeah. Well, thank you so much, Ivan. Appreciate it. And we're going to be moving to our next venture. And you can unshare your screen. Thank you so much, Ivan. And now I'm introducing Candlelit Therapies. And our speaker today from the team is Lauren Elliott. Lauren, are you ready to go here with sharing your screen?
Yes.
All righty, thank you.
No problem. Okay, let's see. Okay, can you hear me and see my screen pretty well?
Yes. Yes, thank you.
Hi, everyone. Thank you for joining. I'm Lauren Elliott. I'm the CEO and founder of Candlelit Therapy. We're a virtual mental health clinic that provides new and expectant Black moms with convenient access to personalized mental health support before, during, and after pregnancy. From the moment a mom hears her little one's heartbeat or feels their first kick, she's a lifeline for her baby. But far too often in the US, bringing a new life into this world can mean risking your own. For Black moms, the stakes are much higher. In fact, Black moms are 4 to 5 times more likely to die as a result of pregnancy and labor complications that often go undiagnosed and untreated. Here's a photo of my son and I 3 years ago. I had developed a condition called preeclampsia shortly after an emergency C-section. Weeks later, I would experience postpartum depression. It took me 2 years to even consider going to therapy, and unfortunately, I'm not alone. Each year in the US, 40% of Black moms develop a mental health disorder by the time their baby turns 1. And these are just the women we know about. The good news, though, is that more than half of these complications are preventable through routine, culturally informed screening and treatment. And that's where Candlelit Therapy comes in. We help moms get screened for mental health disorders early and more often, all while keeping their doctors in the loop through our mobile app. Moms take our anonymous screening survey to get a better sense of where their risk lies, as well as manage their symptoms. They can also discover and book counseling sessions with local therapists in their area and receive peer support from other moms, all in one virtual community. With more than 500,000 underserved Black women giving birth each year, we're looking at a market opportunity well over $1 billion, and that's just in the US. We're hitting 2 key markets, that's maternal and mental health care markets, each highly fragmented as well as ridden with health disparities. Initially, we'll be using a SaaS business model where we're charging local hospitals, birth centers, as well as community clinics a licensing fee per provider for access to our proprietary screening technology. We'll eventually contract with private and public health insurances like Medicaid. For example, Medicaid is one of the largest payers in the country for both maternal and mental health services. So this model makes us extremely aligned with providers who would be normally receiving reimbursements each time they screen a mom using our app. We know there's a growing concern among Black moms about giving birth in hospitals. That's why we're partnering with community health workers like doulas and midwives, as well as local and national nonprofits who advocate for Black women. They'll serve as our distribution partners. We're also seeing amazing growth and engagement on our social media. And we're anticipating that this will continue to grow through our outreach to Black mom influencers to help us shed light on the importance of Black maternal mental health. Unlike our competitors, we're focused on serving the emotional and mental health needs of Black moms who are often left out of innovative health tech solutions. What makes us special is that we're aggregating culturally relevant providers, content, and training all in one place for an affordable price. In just 3 months, we've increased our mailing list to over 300 moms who are ready to join a pilot study that we have set to launch in Q1 of next year with a large health system to prove feasibility and efficacy of our solution. We're also awaiting non-dilutive grant funding from a partnership with Johnson & Johnson. We're looking to raise $500,000 to invest in our current team, our research development efforts, as well as connecting 100,000 moms to mental health screening as well as treatment by next fall. Our team and clinical advisors have more than 20 years of experience in marketing, public health, and technology, all making us uniquely suited to become a market leader in this space. I'm trained in mental health first aid. I've also led $1 million campaigns focused on communities of color for the New York City Health Department. Look, access to mental health care is a real issue. We're looking to partner with strategic partners, investors to help put an end to racial health disparities among Black women. If that sounds like you, please follow us on social media, as well as sign up for early access to our app on our website at livecandlelit.com. Thank you.
Thank you so much, Lauren. Really appreciate it. It's a great presentation. And I was just going to go straight into a judge's question. A judge that we missed the first time was Maria Velasaris.
Oh, hi, Lauren, great presentation. As you know, I'm an investor in this space. I've actually invested in somebody in that chart, Mommy. And I just wanted to kind of understand what the differentiator is, because it seems like the differentiating factor was the education piece, which is also offered. So what do you have that is uniquely different from the other competitors in the field?
Yes, thanks, Maria, for asking that question. So we're definitely seeing a differentiator being that culturally relevant approach that we're bringing to both education training as well as content, and the network of providers that we're offering moms as well. We're noticing that one in particular solution, Mommy, is more of an integration of both infant maternal records as well as maternal mental records. Instead of focusing on mental health, we are going to be drilling down specifically on these needs, which are extremely robust in itself. So we're thinking that that can also be a solution that's very much needed in the market and supplement a lot of the solutions that you might have seen, like, for instance, Mommy.
Great, thank you.
Question.
Well, thank you so much for that question. And next up for questions is from Mark Fillerman.
Hi, thanks so much. Great presentation. Good space, high need. But I have two questions that are kind of interrelated, so maybe an A and a B. First of all, in the screening portion, can you speak to the validation of the instruments used during that screening? Are they yours? Are they somehow externally validated clinically? And then how are the mental health clinicians involved in the solution?
Yes, thanks, Mark, for that question. It's actually really interesting because we're using clinically validated scales like the PHQ-9, for example, and then we're layering on our culturally relevant screens. So the actual first layer of the screening questionnaires are clinically validated. They're old and antiquated, but we're adding a modern twist to them. They're also available already in Spanish and additional languages. So that really helps with when we're starting to translate our own personal proprietary questions into the mix. So that helps us at least kind of get closer to, in our pilot study, proving more of the efficacy once we're already using a clinically validated scale, almost kind of saying like what can we add to the experience? As far as the therapists, we're allowing the moms to be able to seek help one-on-one, as well as have group counseling with other moms. And the actual therapists are going to be leading the moms, guiding them through at least the first 12 weeks of that period, which are the most vulnerable weeks for at least a new mom. But we're envisioning moms coming into the system and the program at different touch points. So the therapist will be guiding the moms alongside that journey. Thanks.
Thank you. Thank you for the answer. Last question was from Noelle Godard.
Hi, great presentation. It's a very important health problem that you're addressing, so it's always exciting to see solutions. I'm curious though a little bit about the business model. So when you presented it, you were talking about $30 per provider, which to me seems like a very accessible price point, but not necessarily a great price point for making money and revenue as a business, particularly if you're going to have to create your full content. I know you said you were going to use some content that was pre-made, and that I assume you'll be creating some of your own, and you need to monitor the peer interaction side of this product. So could you just speak a little bit more to your real costs going forward and how your business model ties into that?
Yes, absolutely, Noel. Thank you for the question. We're seeing the screening and assessment piece as an entry point, an entryway to gain access and build a relationship with the providers. as well as the moms itself. So we're thinking about adding on, offering a suite of products and adding on training, culturally relevant training for providers, in addition to the base price that we're offering. So we're thinking that those can be revenue generating as well. So that's training, even therapist referrals.
So it's $30
we can add
per
that
provider?
on to the actual program as well. Yes. Yeah. So that would be so we would earn or increase our revenue through like add-on products, with the assessment being like the flagship product that we're offering to providers. We're also noticing that moms are gravitating toward birth centers out of fear and anxiety of the hospital. So we're also kind of branching out the providers that we're actually working with. So while a lot of other solutions might be going to employers, we know that that's almost like a double sale, and we may have a hard time reaching the moms. So we're trying to access hard to reach moms, Black moms in a lot of instances. So we're thinking this could be the initial route to earn revenue, and then add on products in addition to scale the revenue.
Thank you.
Thank you.
All right, thank you so much, Noelle, and thank you so much, Lauren, for the presentation. Great job. And so we're going to move on to the next venture. Fourth one is Care Talk, led by John Saiteros and also Rances Tremos. Now, John, Rances, are you ready to go?
Yes, I'm ready to go.
All righty. All right, thank you. Go ahead, John.
Hello, my name is John Sateros. I'm a CEO of Care Talk, and I'm a 2-year millennial caregiver.
Hello, good afternoon. My name is Rances Tremos. I'm a CTO of Care Talk, and I'm a 4-year millennial caregiver. So, this is a story about my grandpa and my journey as a caregiver. Before I start as a caregiver, I'm a college student and part-time worker. So my grandpa was diagnosed with Alzheimer's disease. He's being taken care of during the day by my aunt, while I'm in charge of him during the night. One night, my grandpa fell. When I tried to help him, I caused him injuries. This happened because I lacked training in being a caregiver.
Did you know 32.4 million caregivers are non-professional? 48% are millennials, and they feel the negative effects are caregiving more than any other age group. By 2030, seniors over 65 years old will outnumber children for the first time in US history. That is why we created Care Talk, a digital platform where family caregivers can connect with other caregivers and receive professional caregiving training. We're offering 24/7 pre-recorded and live lessons from a professional caregiver, community via online support groups, and soon educational workshops hosted by universities. We have a total of 170 survey responses posted on Facebook support groups, plus 37 in-person interviews with family caregivers and our summer cessation. 90% mention having emotional stress. 54% have 0 to 5 years of non-professional caregiving experience, and 66% are part of a support group. Here are three millennial caregivers that show the following pain points: lack of resources, Facebook support groups not being affected, and emotional stress. The overall market on caregiving training in the US is $4.7 billion. The $430 is the out-of-pocket money from a non-professional caregiver for education and training. The addressable market based on household income is $1.8 billion. The target market is $100 million, which is the 6% of the addressable market. Our top 3 competitors are Care Academy, Care.com, and Coursera. We're offering a package of educational workshops, virtual community, online training, and multiple languages at an affordable price. We're finding a B2C freemium business model. It's $25 per month, which is $300 a year per user. We're offering several training courses, online community, and soon educational workshops. Our target market size is 330 caregiver users, which is based on the 6% of the addressable market. In year 1, we're going to focus on course development and get early customers to get feedback on our services. By the second year, we will partner with CUNY colleges. And earlier this week, we were talking about the professor about the CUNY Health Initiative and how can we help decrease emotional stress between CUNY colleges. In the third year, we will partner with home care agencies to be an enhancement of their training, as well improve the quality of our course content, as well add new features such as live sessions from professional caregiver and newsletters from professional caregiver. In the fourth year, we will focus on international expansion of our services, moving to other states and internationally. In the first year, we're going to reach 600 users. That's 18% gross profit margin. By year 2, we reach 3,000 users. That's a 43% gross profit margin. By year 3, we will reach 4,500 users. That's a 46% gross profit margin. By year 4, we're going to reach 7,000 users. That's a 51% gross profit margin. And by year 5, we're going to reach 15,000 users. And that's based on the international expansion. We're looking for an investment of $300,000. We will use those funds for course creation, course platform, marketing, legal, and staff hiring. Our vision is to create a healthcare training platform to help family caregivers care for the rapidly growing worldwide aging population, following our amazing mentors and advisors who've been helping us along the way. Thank you.
Thank you very much for the presentation, John and Rancis. It's wonderful. Thank you so much. And we're going to jump right into the judges' questions. First up is Pranavi Shimakurti. Are you there, Pranavi?
Yes, yes.
All right, thanks.
Cool. Thanks so much, John and Rancis. This is a great presentation. And I think, you guys are targeting a market that's not only very exciting and there's a lot of activity happening right now, but it also really targets a real need in our community. The question I have for you kind of is around the seed investment part that you're looking for. So have you kind of thought through the X list of things that you want to accomplish with the funds, how long it would take for you to complete them, and how long it'll take for you to recover the seed investment currently? And then the other question I have for you is around the scalability. So, from a course creation, a course, platform perspective, how do you plan to, use that as your core business model and then expand into adjacent products or adjacent offerings? Or do you plan for this to be your core thing as that you offer to your customers? Have you thought about, what the future looks like from a product roadmap perspective?
Yes. So we will use those funds to concentrate on our website. We have a full working website, but we just don't have the content. So we will use that money to hire caregiver instructors to pay their salaries to help us build the content, as well as marketing, and as well adding new features. As a scalable point, we are targeting millennials because out of all the services available, we feel that that's the only target that's been left out. And I think that's a great opportunity because as we mentioned that the elderly population is just going to keep growing, and that will become a bigger burden for millennial caregivers.
For sure. And have you thought about how long it will take for you to recover the $300,000 investment? It's super early in the market, but it's a question that I would say, something to consider for the future as well, if you haven't thought about it yet.
Yes. So we're still in early stage, but we're definitely planning everything strategically and talking to our mentors and advisors.
Awesome. Great job.
Thank you so much, Pranavi. And next up with a question is Bruce, Dr. Bruce Wiley.
So yeah, thank you for the presentation. So this is an interesting, certainly an interesting venture. I guess one of the exciting things, but also one of the challenges is you're competing against different groups. Like, there's social media platforms where people are sharing ideas and thoughts, and then there are also institutions that are establishing training platforms and things like that. How do you see yourself fitting into this milieu of competitors and distinguishing yourself among these, and also creating sustainability? Because there's a lot of noise out there when it comes to people providing information and exchanging information. And I think one of the challenges is distinguishing yourself from that.
So we had a total of 170 server responses, and most of the millennials they feel even though there are like free Facebook support groups and they get their help there, it really hasn't been like the most efficient way, because as a caregiver, emotional stress is not just is a major thing, but it's not the only thing, which is training and also communicating with all the caregivers. So I think the biggest differentiator, I think, is because we're offering a package that I guess no other company has really done so far. We really think that virtual community is very important in the fact that caregivers do suffer from a lot of emotional stress.
Okay, thank you.
Thank you, Bruce. So we have we can get one more question from Maria Velasaris.
Hi, this is a great concept, and I really like that you're targeting these ethnic populations, because I think this is where a lot of this burden lies. So the $25 a month, is that able to be reimbursed? Because I know in a lot of these communities are underserved, and I'm trying to figure out what $25 a month, while seems relatively economical to us, to some of these underserved communities, this may be a financial burden. Have you thought about how to either augment this or have some types of reimbursement through insurance?
Yes, the $25 per month was from our survey and talking to in-person family caregivers. We put a question about a price range what they pay, and most 90% of caregivers will pay less than $50. So $25 was based on our research and talking to customers. And for the other question, what was the other question?
Reimbursements.
Reimbursements?
If it's able to qualify for any type of reimbursement through insurance. From at-home caregivers, sometimes you can get reimbursed for that. And so I was just wondering if you had explored that, so then it could be free for the user.
We are definitely talking and really thinking about this, but we haven't get to that point yet. But we're definitely going to. So thank you for the advice.
Yeah. Okay, well, thank you so much. And thank you, John and Rensis, for the presentation. Thank you for your work on Care Talk. It's wonderful. And next up, we have Ella, who is coming on. And John, if you were able to unshare your screen. And so Eddie Faustin can jump on. And Eddie, are you there?
And I think you're muted.
Control there. Am I unmuted? You guys hear me?
Yes. Hear you well.
All right, great. Hang on one second.
Yes.
Share my screen here.
All right, thank you, Eddie. You can go ahead.
Perfect. All right. Good afternoon, everyone. My name is Edward Faustin. Today, I'm going to show you how patient insights through simple voice notes can unlock millions of dollars of funding for healthcare institutions. Every dollar counts in a pandemic. Believe it or not, for many hospitals and community health centers, millions of dollars depend on positive survey ratings from companies like Press Ganey or HealthStream. An average mid-sized hospital system can spend as much as $300,000 every year on multiple choice survey platforms. The thing is, multiple choice surveys shouldn't cost $300,000, and they should tell you something useful. That's why healthcare providers end up conducting more surveys using Google Forms and SurveyMonkey. Since these forms are limited in richness of data, the nursing staff will then end up spending weekends calling up and surveying patients on their experiences on top of these forms. Some providers then have to go the extra mile and create entire job positions to analyze advanced platforms like Qualtrics or hire external consulting firms, even more expensive and time. What's clear is that the healthcare survey system is broken. Administrators need detailed input that can help them take action, improve ratings, and ultimately attain more funding. That's where Ella comes in. Our solution provides deep insights that any administrator can pick up and run with in seconds. Ella makes completing surveys as easy as scanning a QR code, clicking a link, and adding a voice note, encouraging higher response rates. open-ended voice input tech is at the cutting edge of survey research. Put simply, voice input means more details of honest feedback leading to robust insights. Essentially, our AI will then transform all of these responses into a straightforward dashboard. And we've surveyed over 50 physicians, nurses, and medical researchers, and more than 98% have said that Ella would save them hours spent on surveys, freeing them up to manage their hospitals and patients. So how does it work? So for a nurse who spends 6 hours a day, 6 hours on a Sunday, calling up patients to ask about their hospital experience, all he or she would need to do is simply log in, create a survey, add questions, and send out a URL or print out the QR code. Patients can access the survey via the URL or use their camera to open up the QR code and then record their thoughts. You can then review responses instantly on a quantified dashboard. Whether you have 10 responses or 10,000, our AI processes do it all for you. We've identified that the online survey industry is a $4 billion market. And we've identified within the healthcare sector 3 focus areas: hospitals, nursing facilities, and private practice. We're proud to say that in the past month, we've secured pilots and currently have 7 healthcare pilots. Pilots include an outpatient community health center within the Crozier Keystone Hospital System, and one of our fellow CUNY cohort participants, Candlelit Therapies, who you just heard from. Our revenue model is a B2B software as a service platform. We charge $70 per user per month annually. This is straightforward pricing, which means you aren't limited to a fixed number of surveys or responses, and our team is here to enable you to gather the richest insights possible. Our pricing is competitive to other industry players, and at this price point, it would take 8 clients with 3 users to become cash flow positive, and over a 2-year span, 60 clients with 10 users each to generate $1 million in revenue. So a story on our team. We came together around joint research regarding logistics and behavior during the COVID pandemic, and each of us brings a unique value to Ella. My background is in research, finance, and economic development. Now I'll be handling strategy. Taylor Getterman, leading product development, has extensive experience in data science and survey research. Kervin Leatham, leading business development, has notable experience in banking and business and will focus on business outreach. Our roadmap for the next 18 months. At this stage, our tech is completed. We have 7 healthcare facilities, as mentioned before, looking to work with us. And now we're up to amping up sales and our marketing capacity. And we're anticipating we can gain 20 enterprise clients by the end of the first quarter of 2021. And eventually, we are looking at opportunities to launch into other sectors by the end of next year. Our ask, we're seeking $200,000 in investment to support marketing and sales efforts. We're also seeking referrals for prospective clients and advisors to provide guidance on additional healthcare opportunities. If interested in learning more about Ella, open your camera right now, scan the QR code. We're excited for conversations around funding and referrals and advisors. Let's fix surveys together. Thank you.
Thank you so much, Ella. Thank you so much, Eddie, and your team for working on this. It's really great. And so I'm just going to jump into the judges' questions. First up we have is Nick Hoffman.
Yeah, thanks very much. Quick question on the pricing. Can you just talk a little bit about that's a per user pricing, meaning per patient, or is that per clinician? I wasn't quite clear on that.
So it's per clinician. So essentially the user, in other words, is going to be the administrator at the hospital. So if the hospital has, one particular administrator per division, then it would be that user. Or if they have 3, that would be administrators who would be administering the surveys, then it'd be 3. Okay, so the process would be they provide a QR code, the patient scans that, provides their voice input, and then that's sent to the clinician. They're charged per clinician, basically. Correct. Okay. Yeah. And then, so it seems like the sales, I'm trying to understand the sales process. So the sales process is really primarily through strategic partnerships. You've already got a number on board. So the sales process focuses on the facilities, essentially. Correct. It's talking to the groups that are working with administrators and essentially we're sort of in charge of sort of the budgets in terms of how they allocate that towards research. So that's particularly for a hospital system. If we go to private practices, it's a different story. Some of these individual PCs have multiple physicians on board. It's really up to them. But there's some cases, some private practices are also managed by specific healthcare systems. So in certain cases, they have to get approval as well. So there's a little back and forth. It kind of depends on who we have to go to for securing the sale.
Okay, thanks.
Thank you so much for that. And Eddie, when you have a chance, if you could take off the screen share. And
sure.
The next up for my questions is Rebecca Woodcock.
Thank you. Yeah, a couple questions. One is around engagement, and there are some other solutions that are rather simple that you mentioned, SurveyMonkey and other things being used. Maybe there's not enough data yet for you to compare, but what are your thoughts about what does a successful completion rate look like, or engagement rate look like to convince a provider to switch to you off of some of these other platforms?
Yeah, hi Rebecca, this is Teo here. Thanks so much for the question. So I would say two things. The first is that if you actually go to someone like SurveyMonkey's website, they actually have a page on specifying why open responses are really hard to gather and even harder to analyze, right? So one of our differentiators isn't just the response rate, but also the quality of the response. We encourage open responses. We say, speak as much as you want, more is better. And there's actually papers coming out right now. There's a researcher in Spain who's very dedicated to this, and I've read all of his stuff, where they're finding out that there's even more, you can get much richer data if you just let people speak rather than making them type it all out, or God forbid, a multiple choice. So I would say the quality is one of our primary differentiators. In terms of survey response, in the process of getting someone to fill out a form, right, just being very upfront on saying it's one question, just leave a voice note, right? It's hopefully that's a promoting activity, and we make it very easy on the platform to have URLs, QR codes, so you can send it out, plaster it all over the place to really encourage a high response rate.
Okay, and then I guess my follow-up question is, what sort of insights, you mentioned that you get richer data. Can you give some examples of how the technology parses and uncovers that richness?
Sure. So this is the product answer is we do either a week supervised learn, so that we're actually taking in the data and then finding out specific topics and narratives that are shared across the larger survey body. And the other one is that if we're getting custom work and we say we really need high accuracy on, we need to know these very, very specific topics, we'll do a supervised learn and actually look through that data. At a second level, I would say that in general, the AI is what's really powering us to save hospital administrators hours of work and lower the bar. So you don't need technical knowledge to go through a process of finding each topic and identifying the keywords, and how survey research is currently done with open responses. And it just lowers that technical bar. So you just log in and then you're ready to go.
Thank you for that.
Well, thank you so much for your questions. And thank you so much for the presentation and answers. Ella, done a great job. I was just going to move on to the next presenter here now. And right now we have is In Care, led by Pamela Cooper and Michael Morath. And they're already sharing their screen here. And you'll hear from them shortly.
Great. Hi, everyone. I'm Pamela. This is Michael, and we're the founders of In Care. During the coronavirus crisis, we've all experienced stress, anxiety, and loneliness. Stress about what will happen to our loved ones and their health, and anxious about the future and what it holds, and lonely because of isolation. In the middle of this pandemic, we're seeing a mental health crisis arise as well. Even before our world was turned upside down, the numbers of Americans that are experiencing severe stress has increased 44% over the past 5 years. 19% of Americans are diagnosed with anxiety-related disorder, and especially during COVID, 3 in 5 Americans are claiming loneliness.
Yeah, and this is where we come in. At InCare, it's our mission to help people to manage their mental health on their own terms. And that's why we've designed Ease West, a smart compression garment that can help you to calm down with the squeeze of a hug. And here you can see on the left is our working prototype of our compression vest, and on the right is our companion app that can further amplify the effect of our vest. And our product works with micro-inflatable air pockets that are embedded into the fabric. And those air pockets can be activated with the press of a button or with a self-hugging gesture, just like this. And what really enables our product is our smart inflation unit, which is small, battery power, fits into the side pocket of the vest and has a very quiet air pump, so you can bring it wherever you go. Our product is based on a scientifically proven principle called deep pressure touch, which is also used in other compression vests as well. And there's a lot of scientific research that deep pressure touch can reduce stress indicators such as adrenaline and cortisol in your body. It can also reduce heart rate, and it's proven to spark the creation of endorphins, which is a happiness indicator. We've worked with the autism community, and we've targeted this group of people that needs our product the most. People suffering from autism have the most severe symptoms, and we can help them to ground themselves when they're experiencing overstimulation. But down the road, we're targeting a larger mental health and wellness market. We can help people with stress, anxiety, and especially in times of COVID-19, with loneliness as well, where a virtual hug is the best thing you can get. And besides the hardware, we also have a great software component as well. We are the only compression company which is collecting biometric data, so we can improve our compression cycles over time. We also have a skill building platform, so you can work with your therapist, and you can also manage your mental health with a journaling feature to keep track of your emotions over time. Here's a quick run through our app. We have an onboarding exercise. We have the option to create your own custom compression cycles, and this is one of our relaxation exercises. You can also share hugs with family and friends over social media messengers, such as WhatsApp or Facebook Messenger. And you can even share data with doctors and caretakers if you wish.
And the adaptive clothing market is huge in the US. It's worth $279 billion. And we're targeting the health wearables, which is $13 billion. And from that, we're targeting mental health wearables, which is which is worth $578 million.
So here you can see the competitive landscape we're in. Most of the products in the market are actually quite expensive. They're priced as medical products and not as consumer products. They can't really reach the people that need it the most. They are very bulky, have manual hand pumps, so you really can't use the product in public at all. Our product, however, is smart, inconspicuous, non-stigmatizing, and you can bring it wherever you go. It's pretty much like a weighted blanket that you can bring along.
And our target retail for early adopters is $300 for hardware and $5 a month for our subscription fees. And we believe we can grow our financials exponentially, not only by targeting the autism community, but by the general wellness community.
And over the last few months, we've been working really hard to improve our working prototype, and we've now secured manufacturing, but this is just the beginning of our journey. We are targeting the general compression market with inconspicuous undergarments that you can wear under your everyday clothes. And we can also target and conquer the huge pet market with there are actually products in the market called Thunder jackets that we can drastically improve with our compression technology. And we can also license our compression technology to other companies, especially in the sports field, such as Nike or Adidas. So we are planning to raise 300K as our angel round, and this will last us for the next 12 months. This is our great team. Pamela's background is in fashion and business development. My background is in product design. I've been helping startups to develop and bring their products to the market for the last 3 years. And we have a great board of advisors in the medical and autism community.
Thank you. We're in care and we're here for you. Let us know if you have any questions.
Thank you so much, Pamela and Michael. Wonderful presentation. Thank you so much. And just to jump straight into the judges' questions, of course, we're next up is Stan Kachnowski.
Yeah, thank you. Wonderful presentation and very impressive product. You know, I think the big question I have right now is really the go-to-market strategy. We've seen a lot of B2C and a lot of B2B in digital healthcare over the last 10 years. B2C has been less successful, B2B more successful. So what's your go-to-market strategy, and what risks do you see in that strategy that you're planning to mitigate, and how do you plan to mitigate those risks?
Right, good question. So we are targeting like early adopters will be B2C. People can afford it, but long term we are actually planning to do B2B as well, like to sell our waste in bulk. We actually have a very comfortable margin, so we can lower our retail price. You know, when we go B2B, we can be a lot more affordable at bulk, and we also, you know, hiring a team of salespeople that is experienced in this field, you know, so they can knock on doors and get us in touch with, you know, doctors' offices, therapists, and hospitals. Because what's really great about our product is we don't really need FDA approval. Other products in the market also are being used without FDA approval because our product is not really invasive, so we don't need that. And down the road, we are targeting the option to do FDA approval. So we are reimbursable by insurance providers, but we are not targeting right now this FDA approval because this is a long process, but we can use existing products to help us to speed it up a little bit.
And for B2B, we're gonna target specialty schools, the people who like work with the autism community and teach them from kindergarten to 12th grade. And we're also going to look at hospitals because they have like specialty rooms that actually buy these compression vests in bulk.
Great, thank you.
Mm-hmm.
Thank you. And before we move to our next judge, Mona Mawafi, Pamela and Michael, could you unshare your screen so we can see your faces?
Oh.
Yeah.
Sorry.
I'm so sorry.
All right, so please, Mona, you can go ahead.
Sure, thank you very much for your presentation. I have two questions that are sort of interrelated. First is you talked about targeting the autism market, but you've also talked about some others. You started your presentation with loneliness and COVID and sort of the pandemic of loneliness in America. And at the very end, you mentioned quickly something about sports, which I didn't quite absorb. Can you talk a little bit more about the particular segments within your market and how do you plan to target them? And then in terms of public health impact, if you could maybe go a little bit more deeply into the autism market in particular, or with all three of the segments, if you have data or a chance to talk about what does the data actually look like? So there's the presumption based on the presentation that it makes a difference, but you haven't talked a lot about what difference it actually makes and what evidence exists around that.
So let's talk about the autism market quickly. So Pamela's sister, she's actually a ABA therapist and she works with kids that have autism. So we've had a chance to learn more about that market, and she's already using those vests, but they're not very good. They're expensive and they pretty much provide a very low user value. There has not been much innovation in the field of compression vests in the last few years. So I think we can really bring a lot of value. And so besides that, you asked about the general anxiety stress market, right? So deep pressure touch is a proven scientific principle that helps with autism, but also with many other symptoms. Actually, it can calm down everyone. So I don't suffer from autism, but it feels great on myself too. It feels similar to like a weighted blanket would feel, but a weighted blanket you can't really bring wherever you go. And so, for example, some people also use it it helps them to fall asleep faster and easier. So that's another thing we can do. And then like we see this not only as a medical product, we worked hard, you know, Pamela's background is in fashion design. So we want to make this really fashionable, like a jacket that you can bring wherever you go. It should not like a medical product. So we want to make it very inconspicuous and not non-stigmatizing, you know. And then about the third field, so actually the pet market is huge too. So there are jackets in the market for dogs, you know, when there's like a thunderstorm or like some dogs have like separation anxiety. Mm-hmm. And there are products in the market. When you go to Petco or PetSmart or Amazon, you can find many of those products, but they work manually by applying tension. But we can, you know, do it with our compression technology much better. And you can use your app, so the owner of the pet can do it remotely even. And then there's the sports market. So there's a lot of compression socks, compression underwear, and potentially we have some options there to partner. But this is further down the road. So it's definitely the autism community first, then the general mental health and wellness market, and then pets probably.
Yeah, and also for the market, like this is a general kind of wellness product because it's based on that principle of deep pressure therapy, which is similar to swaddling a baby when they're distressed. So everyone can use this basically. Like we've all been hugged and it feels good and releases our endorphins. But what we're doing is kind of just automizing it for the autism community since they're already using this, but it's hard to put on them as like studies shown from my sister's studies that like it's hard to put on her kids and parents can't really like keep track of what's happening in their kids' lives. So imagine you have a kid at school and you're at the office, you can send them a hug whenever you feel that they're distressed on the app and they show you the data.
Well, thank you so much, Michael and Pamela. Really appreciate it. And thank you, judges, for your questions. We're just going to move along to our next venture. Thank you so much again. Next up, we have Param. It's coming from the Aware Health team. Param, you ready to go?
Yes. Can you see my screen?
Yes, I can. Thank you.
Thank you, everyone, for having me. I'm Param. I'm one of the founders of Aware Health. Our mission at Aware Health is to create technology to enable early detection and treatment of mental illness. Mental illness can go untreated for long durations of time. I experienced this personally when one of my close family members had a serious mental illness that was only started to get treated 3 years after the initial onset. Currently, the average duration of untreated mental illness is between 3 to 10 years, depending on the type of illness. And this is not just me and my family, but this is about 25% people in the world that are going to be affected by mental illness at some point. The primary reason why this problem exists is because the current treatment models are not scalable, and we expect a huge shortage in the mental health professionals as we go into the future. And the compounding or a secondary reason this problem exists is because our diagnostic tools are not accurate enough, which are survey-based diagnostics for diagnosing mental illness. So we address this problem by having a treatment-first approach. Our therapeutic is what we're focusing on first, which is a one-to-many care model, has been proven to be clinically valid. And based on that, we're also going to create our diagnostics in the future, which is going to use natural language processing algorithms to provide feedback to the therapist as well as to the user. But our current focus is treatment first. We're focusing on creating therapeutics. Our initial target market is exclusively, as of now, the legal professional market. We have chosen this because our law professionals are much more likely to suffer from depression as well as other mental illness compared to other professionals. And this also has a huge financial burden on law firms. We have done our own homework as well. We have spoken with and interviewed more than 100 law professionals and decision makers across 30 firms. What we have learned from this process is that firms are looking to improve the adoption of their existing solutions based on the existing treatment models, which are reactive. And from the users, we've learned that there is a lot of need when it comes to sharing about best practices about mental health and well-being. So with that in mind, we are creating a therapeutic based on the one-to-many model, in that we connect a therapist or a coach with multiple users, and we also connect one user with multiple users. And this model is meant to provide easy access. We don't require that somebody has a diagnosis of mental illness to speak with other users or to participate in our workshops provided by therapists. Compared to other solutions in the market, most solutions in the market are focused on digitizing the traditional face-to-face therapy using chat, using voice, and so on. Whereas our goal here is to introduce a novel one-to-many care model, which has to be tested in the clinical setting, but has not been applied commercially. And we are also the only tailored solution that serves each professional community, starting with law professionals. On the platform, the user can do exercises, receive support and give support to peers, and participate in workshops provided by our coaches. We have made the platform to be anonymous based on user feedback. It's completely anonymous. This is some of the steps where user can select sub-communities within law profession and then they can join one of several well-being channels or professional development channels. And on the example channel, the channel is moderated by clinicians in the back end, and we provide constant updates on the channel for people to talk to, respond to, and they can also post their own content in addition to our updates. These are the other two features of the platform. On the left is the exercise section, where we have a virtual assistant who updates new exercises to the user every week. And on the right is an example of a workshop we recently conducted for anxiety management for law professionals. This is a dashboard. We provide analytics to the law firm, which is anonymized and aggregated month by month to get them a feel of how their employees are doing over a period of time. So far, 4 organizations, 2 law schools, and 2 firms have agreed to pilot with us. We have already conducted over 10 workshops, which have been participated by 500 law professionals, and we have received positive feedback from them asking for a weekly presentation of our content. Our target market is legal, but beyond that, we're going to service other markets like finance, healthcare, and consulting. Our model is based on a per employee per month subscription based on the size of the firm. It is going to take us 20 average size firms to reach 1 million ARR, and we expect to get that within 1 year from now. And we already have 4 of those done. Our team, this is our core team. There is an expanded team, has experience in mental health technology as well as in law. And our advisors are also quite deep in this space. John is one of the world-renowned psychiatrists, and Dom and Lisa are advocates in the legal well-being space. Today, we have raised approximately 100K from leading institutions like Cornell, NYU, and the city of New York. And we're looking to raise 500K for 1 year of financing. We are going to spend most of that in business development, but the remaining will be distributed for developing the therapeutics, further adding more features, for the diagnostic development after we collect data, and as well as for doing our own clinical validation in the future. Thank you.
Thank you. Thank you so much, Param. I really appreciate it. It's great work done by you and your team. Now it's going to bring this back to the judges, of course. And now first up is Mark Fillerman.
Okay, great. Thank you so much for that presentation. I've got a flood of thoughts and two questions. The first may be easier than the second, but since you're targeting lawyers, I assume you've thought about security and the maintenance of security to minimize any litigation risk. So if you could speak to that, that would be great. But sort of more broadly about the validation of the one-to-many and the fact that that's actually an advantage, and kind of related to that, why sort of targeting the lawyers directly, not the law firm?
So yes, so for the first question, we did do a very careful design of our privacy policies, and we also designed our platform to be anonymous. We also have very strict regulations on not sharing either identifiable or non-identifiable data. And then on the second question about the one-to-many care model, that has been implemented in clinical settings. Often it comes in the form of peer support and group therapy. And that model has not been implemented in the private or the commercial space. And we are a B2B company. I'm sorry if it did not come across clearly, but we do sell directly to law firms, and we offer per employee per month subscription to them.
Thank you.
Great, thank you. And the next question is from Noelle Goddard.
Hi, nice presentation. I'm curious about a few things. So law and these other professions you're mentioning are wildly competitive fields, which add to the problem that you're describing. What do you think the tendency to misrepresent individual your actual stress state is when you believe, that this is being reported as a general statistic to the firm?
So we did the user research, and we found that as long as most of our users before joining, they review our privacy policies, and we mentioned during the onboarding what is the security features of the product, and we haven't seen an obstacle in terms of participation if you're only reporting aggregated data and not specific data. And we've added further measures, like for example, to form a group within our platform, we require a minimum 10 participants. So if somebody wants to form a group of LGBT identity and female identity combined together, so it could be female lawyers who identify as LGBTQ+, then we require at least 10 people on the platform to be able to form that group. So that further takes care of the security concerns.
And the second follow-up question I had was about the value proposition to the firms themselves. So, there are similar models, not in the wellness space, but in the sort of corporate social responsibility space, for law firms to decide as a firm that is their identity that they care about this, and they're going to provide it as a service and a metric, how they engage with the community. Is that what you're seeing as also your outreach and value prop?
Sorry, but I think your voice is breaking for a part of the question after you said value prop for firms. Do you mind repeating that?
So I just want to clarify, what is the value to the firm that you're envisioning when you're trying to onboard a new firm?
Yes, so the primary value that we offer is improving retention. And that is the value that can directly tie into the return on engagement. So data has shown that over almost half of the lawyers that leave the firm within the first 6 years are because of stress and mental health reasons. So, and that is attrition is a huge cost for even a 100-lawyer firm. And then in addition, the research that has been done on this model primarily has been done in Australia, has shown that within 12 weeks of engagement, there will be a reduction in depression and anxiety symptoms, as well as improvement or reduction in mental health stigma. So that is going to help to improve productivity overall for the employees, which can be directly reflected through engagement. So that's the primary value prop, retention and engagement.
Thank you.
All right, thank you so much for the question and the answer. We are running a little bit short on time, so we're going to move to our next venture. It's going to be PICXplore. And thank you so much, Param, again, for your time and for your presentation. It was really wonderful. Now, Thomas Jumper and Zachary Shackett, you're up next.
Perfect. Hello, everyone. How are you doing today?
Thank you.
Hello, my name is Zach.
And I'm Thomas.
And we're the co-founders of PICXplore Health. We're building a mobile application that enables you to mitigate your risk of contracting COVID-19. We're giving everyday people the tools to be in control of their exposure.
Common strategy to mitigate the spread of COVID-19 is contact tracing, used by Google and Apple. Simply put it, contact tracing takes too long and the information comes after you were exposed to COVID. We're utilizing data from NYC Open Data, the MTA, and the New York Health Department. We transform this data into an easy-to-use map that uses red, yellow, and green to indicate areas that are good or not good to go to. This is all built robustly on Amazon AWS platform and Google Data Platform. Not only are we collecting this data, but we are packaging this data so that applications can get enhanced with our data, such as Uber, Eventbrite, and Meetup can all be PICXplore enhanced.
Our overall market is 255 million adults in the United States. Of that, we noticed a correlation between interest in our app and those who wear a mask. That makes our addressable market 112 million people. Of this, our target market is 4 million adults who wear a mask. Our preliminary market research has shown that people who wear masks are more likely to want to mitigate their exposure and thus download our app. Our target market is 1.5% of the overall market. We value users at $20 per year based on the sale of Waze to Google, another map data app. Overall, our target market will generate a user value of $80 million. We use user value as our benchmark because we do not expect to make revenue for the first 2 years.
The takeaway from our financials is that our user value will grow much faster than our expenses.
We are looking for an investment of $500,000. This will help us expand data partnerships, our outreach, pay for our minimal server cost, and add in AI to develop predictive models. Overall, it will allow us to get more accurate data and do more with that data. The takeaway here is that we're going to keep developing partnerships to collect more data and make our API more compatible and push towards rapid growth.
So I graduated from Adelphi University with my degree in finance, and Zachary graduated from Baruch University with his degree in mathematics. We both work well together, and we're always looking for the simplest and most robust answer to the problems we face. I want to thank everyone, and I hope you guys are staying safe. If anyone's interested in seeing the beta version of the app, just send us an email. Here's our contact information, and if anyone has any questions, we're all ears.
Thank you so much, Thomas and Zach. Great work that you're doing. Thank you so much for the great presentation. And so the next judge for the next question coming up is from Pranavi.
Thanks so much, Alessandro. Great presentation, guys. I'm curious to hear about, from a competitive landscape perspective, how are you different from the Google and the Apple solutions right now? And then I know that local governments currently are rolling out contact tracing as well. So curious to kind of hear about, what your competitive differentiation is. And then kind of a step further than that is what's the big vision for the company? Where do you kind of see this going in the next 10 years?
Sure, thank you so much. So essentially contact tracing today is kind of a really slow process. Apple, Google, they wait for a confirmed case and then they try to come across who their users have come in contact with that were positive. There's a couple issues with that. The first one being no one's using a unified database. So in order for contact tracing to be pretty effective, you need about 60% population using one database, which is kind of hard because Apple and Google, their issues so far 14 states already said that they're not using their database. So that's one problem. And the problem is by the time with contact tracing that you're notified, you've already come in contact with that person. You've already, if you're infected, you're already infected. It doesn't really change. It doesn't influence what time you're going to the grocery store and stuff like that. So what we're trying to do is we're tracking population movements in order for you to social distance easier. We want to keep you away from the crowd. And that's what we're doing. We're giving the tools so you could decide, I want to go to the grocery store, but let's go 2 hours earlier because it's a lot less crowded there.
So the way you're kind of thinking of it is almost as preventative contact tracing.
Exactly. Let's be preventative and let's keep people safe, and so that they hopefully will never be notified that they came in contact with someone.
Got it. And then what's kind of the big vision for the company? Where do you see this going in a non-COVID world, or not in a post-COVID world when life somewhat comes back to normal?
So to create the data, we had to use many indirect methods and many unconventional methods, which came from a diverse group of data sources. So it's solving a diverse group of problems. So we could do is use this data backwards now to go and solve those problems as well. The possibilities are truly endless. For instance, one of the places that we were looking at, it's a company called Planter, which uses population data to inform businesses on where the best place is to open up. So we could expand for economic growth, and we could even expand to future diseases and help track those diseases outbreaks before they become outbreaks.
Got it. Thank you.
Thank you so much for the questions.
Thank you so much for your question. Thank you, Pranavi, for your question. I have one last judge, I believe. Maybe there's two more. Bruce Wiley, you want to take it away?
Yes, thanks for the presentation. Of course, very timely. Big question when it comes to these contract tracing apps are privacy concerns, and actually specifically how the data is used, and of course this extends beyond COVID-19. So I'd be interested in hearing about what your data plan is, and also verification and validation of the data as well.
So that's an excellent point. So first of all, we're very conscious of privacy, and to be conscious of that, we're using already collected publicly sourced data. That's our first layer. This data is already being collected. It's collected by the city, by the state. It's all anonymous. Then what we're doing is we're using proprietary data collected by the users, but it's anonymous from the user, and it's consensual by the user. The user submits when they want to have this data collected by them, when they self-report, we call it. And the user is entirely in control of their data, of their privacy, and when they would like to submit this data to us. But no information of the user is stored or used by us in any way. We're more interested in the metadata than the individual data because we're not directly contact tracing.
Thank you. Great, thank you. And we have one more question. And Maria, you want to chime in?
I think, Mona had one. Okay. So I think this is a really interesting opportunity. I was also interested on how you would continue to expand going forward. But how do you plan to gain adoption and traction. I didn't really see a go-to-market strategy, and it sounds like that's going to be really important in helping direct and add data and volume and legitimacy to the data. So what is your go-to-market strategy, and how do you plan to maintain and retain these customers?
Yeah, absolutely. Excellent question. So kind of that was our big first question is how do we build, because the problem is if you build a contact tracing app, you need penetration. And in reality, no one's going to get 60% penetration in any market in such a short time frame. So what we started off with was publicly sourced data. The great thing is if we have one user or we have millions of users, we still have that baseline publicly sourced data to pull from that's giving us value. But what we're going to rely on here is a couple factors. We're going to rely on the network effect, that people with this app feel safer and they let other people know that they feel safer. We're going to run advertisements, and we're expecting if we run advertisements, by the time someone actually downloads it, it'll probably cost us about $6.80. That's just general how it runs with advertisements. So we're going to rely on advertisements, kind of a network effect to really push us out, and hopefully our partnerships, since we're building a very easy to use API, it could be very easily implemented into already existing apps. And from there, we could already pull more information and more data from, and people could be using our product.
All right, thank you so much for your question, Maria, and the other judges. And thank you, Pixlr, for presenting. You can unshare your screen now. And also, thank you so much to all of the ventures for presenting. We somehow just went through 8 ventures in a marathon pitch. That was really, really great. Thank you so much for everybody sticking in there.
The way this event works is that we started with doing the event on Monday, and then the fans began to vote using the pre-app from Monday onward, and they can vote all the way until we end the event for voting in about 5 minutes. The judges also vote. And so the judges have a different space for voting. And so what we're going to end up is announcing the winners based on the judges, the 3rd, 2nd, and 1st place. And then we'll be announcing the fan favorite and also the top investor award. So exciting. I press a little button and let's see what the tallies are. Dun, 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 dun. Okay. And all right, so we're gonna announce the 3rd place winner. The 3rd place winner, if they will unmute them, is Ella. Ella came in 3rd place by the judges' votes. So let's get Ella on there. Come on, Ella, where are they? Where's
Right
Ed?
Thank you.
All
Thank
right.
you. It's an honor. Appreciate it.
Way to go. Excellent.
Thank you very much. Thank you.
All right, number 2, 2nd place is InCare. InCare, come on to the stage.
Thank you.
Thank you so much, guys.
Thank you so much.
Thank you.
All right, and then in 1st place, the winners of the Public Health Innovation Accelerator is Candlelit Therapies. Candlelit, come on up, wait, woo!
Thank you. Thank you, oh my God.
The fan favorites, in the number 1 spot is Care Talk. Care Talk is the favorite. And then the number 1 investor was Luis Gualpa. Okay? And then, so yay. So the first prize, and the prize money came from MUFG Bank and the Graduate School of Public Health, Terry. Thanks so much.
Well done, everyone. Congratulations.
Yes, this was exciting and a lot of fun. And again, thank you to the judges for taking the time, the mentors, Terry, Alessandro, you guys are all stars over the Graduate School of Public Health.
Thank you.
And then thanks for everybody put the effort. Our mentors were just outstanding rock stars. Our speakers were outstanding. And this was one of the most fulfilling experiences I've had, having done probably well over 100 of these demo events in the past. So that says a little bit. So thanks, everyone.
Thank you, Remy. Thank you, Alessandro. And thank you all for attending today.